Welcome. I'm Dr. Humaira Siddiqui, and thank you for joining us. I'm a board-certified Permanente doctor, and I'm a specialist in interventional psychiatry, practicing in the Northern Virginia area. And I'm joined by my outstanding colleagues, Dr. Mrinalini Chakrukar and Dr. Sarita Kaza. We are very excited to be talking with you today. Dr. Chakrukar, would you go ahead and introduce yourself to our audience?
Hi, my name is Mrinalini Chakrukar, and I am one of the Permanente physicians. I practice pulmonary and sleep medicine, and I've been practicing in Northern Virginia area for 20 years, and I've been working for Permanente Group for last 8 years.
Excellent. Dr. Kaza, could you introduce yourself as well?
Hi, my name is Sarita Kaza. I'm an otolaryngologist, head and neck surgeon. I've been at Kaiser Permanente for about 13 years. I subspecialize in sleep surgery, and my practice is located primarily in Falls Church in Northern Virginia.
That's excellent. Thank you for joining us. And to our viewership, we look forward to your questions. So if you're watching live, please post them in the comments section. We'd love to hear from you. So I'm going to kick off our conversation by talking about our cavemen ancestors. You know, our ancestors didn't always sleep through the night. It was more common for them to be awake for a few hours and then be asleep for a few hours. And in a way, this natural type of sleep kind of came in waves because it allowed us as a community to watch out for predators. And it also is what enabled tribes to protect itself. Because if you think about it, people would have to take turns on watch, looking out for predators, either day watch or night watch. Now add to that hunting. We aren't biologically the best hunters. We are definitely not built for it. We don't have claws. We have terrible night vision, so we're not good nocturnally in that way. And we are bipeds, so we really can't compete with other predators in terms of speed. But what we do have above all other species is our endurance and our patience and our intellect. So if you think about the way that we had to evolve and the way we think about sleep, we had to learn to optimize our evolution by being able to evolve ourselves to function optimally by daylight. Now, when you translate this to babies, most adaptive versions of ourselves, even babies don't sleep through the night. So for those of you who have newborns or even toddlers, it takes a while to get them to sleep through the night. There's a reason for that, though. They have babies they have a few segments of sleep. They have segments of wakefulness. And what our ancestors and our caveman ancestors learned was that by civilizing ourselves, when we started to get more agricultural, when we started to develop ourselves as an organized race, that we had to learn from a very early stage that we had to train our offspring how to tie these segments of sleep that were coming in waves together so that they would sleep for longer periods of time through the night to allow them to be awake through the day. So the result, we create our sleep architecture. It's not something you're born with. It's something that you have to build. And when it comes apart, you have to build it back up. So to understand this better, I'm going to pose some questions to my colleagues to help better explain sleep. So Dr. Chakrukar, before we go into what is abnormal, what would you be able to explain in terms of what is normal sleep? What happens to the body and brain when I go to sleep?
Normal sleep as opposed to abnormal sleep is waking up feeling refreshed. It's having a normal mood, feeling clear-headed, and not needing support from caffeine, tea, and other drinks to stay awake and focus. Okay, having a good sleep cycle, that is normal sleep. Sleep, as you know, is essential for our health. It's one of the essential pillars of our health. And there are several things that happen in the brain when we sleep. The two most important things that I want to discuss with you today is how sleep affects our memories and how sleeps help with reversing some of the aging related changes that happen in the brain. First, let's talk about the memories. Okay, I want to give you an example that you're familiar with. Okay, I want to talk about your inbox. Okay, you received lots of emails on a daily basis, whether it's your work email or whether it's your home email address, okay, personal email address. So some of the emails are obviously junk and you don't need them and they can be deleted. Okay. There are other emails like, you have a meeting next week and you need to have that meeting and its content, saved until next week. Okay. And then there are some very important emails that you need to save for much longer period of time. Memories are like that. There are most memories which are acquired by brain on a day-to-day activity are not necessary for our functioning as well as long-term survival. Okay. But there are some memories that you do need to keep them in a short-term storage. Okay. They're needed for a few weeks. Okay. And then there are some memories that are needed for long-term storage. Dr. Siddiqui had talked about our caveman ancestors. Now, you need to remember for long-term basis how a particular predator is going to attack you. Otherwise, human as a species will not exist. So there are different types of memories. And when we sleep at night, the brain kind of removes some of the unnecessary memories from our brain. There are some memories that need to be stored in the short term. They get stored in the short term memories, and the most important memories get stored in the long term memories. Okay. There are connections that develop between the cortex and the other structures such as thalamus, and there is a information exchange. You can call it high speed internet, and that exchange causes permanent change in the memories. Okay. The second function of the sleep is how it affects our aging or reverses our aging. During the daytime, brain is very, very metabolically active. It's doing a lot of different things. It's forming new connections, and it requires a lot of energy. So when you use up a lot of energy, there are a lot of metabolites or waste that happens, and that needs to be cleared up. Okay. During the nighttime, there are spaces in the brain that open up to remove these waste products. And one of the products that is removed is called as tau protein. And that protein is very important in dementia, where we see a lot of plaques of tau protein, and removing this protein helps reverse some of the changes associated with aging, and it keeps our brain fresh and functioning normally.
And I've heard of things like the circadian rhythm, and I've heard, many of my colleagues who are also sleep specialists, they say that not every person has the same circadian rhythm. And when we think about a 24-hour day cycle, we think that all of us, live and breathe, wake and sleep by 24 hours, but some of us actually have a 23-hour circadian rhythm. Others have a 26 hours. And so when you have that, some of our days and our patterns shift in one direction or shift in another, kind of like leap year, where you have to sort of compensate and accommodate for that. And so in some ways, if you have some quarters every 3 months, you're like, I don't know why I'm not sleeping so great. Could be because your circadian rhythm is not a perfect 24 hours. Could be that you're a 23, a 26, a 25. So we want to kind of think about what is natural sleep. Why do we need it? And you're absolutely right. Being able to eliminate the waste, the byproducts of any kind of metabolism in the brain cleanses itself at night. And you need to have really good restful sleep. The other thing about sleep is that it occurs in waves, right? So I tell my patients it's like dolphins, right? They surface, they get some air, they come back down, deep sleep, surfaces, come back, get some air, get some deep sleep. That's very normal. And sometimes we don't even remember that we've woken up at night because we're able to get ourselves back to sleep. That doesn't always happen. And sometimes that sleep shifts. You were talking about aging. So there's the brain can age, meaning the toxic byproducts cause us to age, like the way a dermatologist might say you're getting too much sun exposure and that's going to cause premature aging, dementia of the brain is that concept. But what about normal sleep changes that occur as we age? Tell me a little bit about that.
Sleep changes throughout life. When the infant is born, they're sleeping for most of the day. They're sleeping for 20 out of 24 hours. Their sleep comes in cycles. Okay, their sleep comes in 90 minutes or such cycles that happen. They start with dream sleep versus most adults start with a non-dream sleep. And as the brain matures, your sleep cycle changes. If you, by I think 3 or 4 months, you are able to sleep. Most of the infants are able to sleep through the night, and then slowly their daytime sleep shrinks. About the age of about 5 or 6 years, they stop taking an afternoon nap. Until then, afternoon nap is very important for your brain. Then, as we grow older, the sleep pattern shifts again. Teenagers have a lot of different changes that happen. First of all, their circadian rhythm, as you were discussing, shifts. They tend to sleep late and they tend to wake up late, and their sleep need is a little bit larger than preteen. So they need to sleep for about 9 to 10 hours to get adequate amount of sleep. Okay. And as the teenagers grow into adult, the sleep pattern slowly matures into an adult sleep pattern, which is about 7 to 8 hours of continuous sleep. And as we age again, the sleep pattern keeps shifting. As you get older, your sleep changes. Some of the changes that we see in older patients are related to their medical problems. A lot of medical problems are seen in older patients. A lot of them are on different medications, and that can affect the sleep. And also, even without medication or without medical problems, the sleep tends to become a little bit more fragmented in older patients. That means they would wake up at least once per night to wakefulness and remembrance, and then go back to sleep. Unlike teenagers who tend to sleep late and wake up late, older adults tend to sleep early and wake up early. So there's again a shift in circadian rhythm. There's also changes that are different in women and in men. The men tend to have more of the age-related changes. Women tend to preserve their sleep pattern a little bit better than men do at aging. And there are wide variations that happen.
I would have to agree with that. When we think about teenagers, they actually need a tremendous amount of sleep. Think about an adolescent brain or just your high schooler who's just studying as much as they can, and they're very, very active. And yet they're ironically the group that doesn't sleep as much. And so they start to get brain fog. They start to become inattentive. They start to have difficulties with focus, concentration, and attention. And it starts to look like a different diagnosis altogether. If you think about it, it may not be some of the focus and attention things that the popular media has sort of pushed into the forefront. It may just be that get some sleep, reduce that photo stimulation from a computer. I'm going to talk a little bit about the circadian rhythm as well, because as a species, we've evolved with the sun. And I'm going to speak as a psychiatrist. We talk about conditions such as seasonal affective disorder as if that's an abnormal disease state. And I want to kind of emphasize that in the winter, we are supposed to slow down. In the fall, in the autumn, it's a beautiful season, but we're kind of supposed to be a little antsy, right? Think about your ancestors foraging for food, preparing for a winter. So slowing down a little bit is very, very normal. And sometimes sleeping a lot is not necessarily a negative thing if you're looking at the seasons. So when bears do it, we call it hibernation. When humans do it, sometimes we may misinterpret that as depression. But I want you to think of depression not as always an emotion, but think of depression as just putting your whole brain and body on low power mode. So there are times that you're going to have not insomnia, but something called hypersomnia. It's a way to describe sleep. Dr. Chakrakarta, tell us a little bit about what you understand in terms of when a patient comes to you and they're sleeping too much. Because as a psychiatrist, the first question I'm going to ask is, are you depressed? Is something going on? Are you overworked? Are you burned out? Are you just not getting enough sleep? I look at nutritional things, all of us do as physicians. Are you not eating a healthy diet? Are you drinking too much caffeine and then your body's taking revenge on you? But there are conditions, and Dr. Kaza, I'm going to jump to you as well. What are some of those conditions that you think create a hypersomnia state, meaning you're sleeping too much? This is outside of the norm.
we can look at hypersomnia in two different ways. There are some patients like, a sleep apnea where your sleep is disturbed at night. It's disturbed multiple times. Like some people have very fragmented sleep cycles, so they don't get the rest or the changes that need to happen in the sleep that we described earlier normally. So the sleep pushes, intrudes into wakefulness. So they are sleepy in the daytime. Whenever they are inactive, they will fall asleep. They can have micro sleep. So it intrudes in the daytime. So these are the people who have very fragmented sleep. There are some people who have circadian rhythm. So they sleep very late. So when they can't wake up in the morning, and that can sometimes also get labeled as hypersomnia. Then there are other people who have conditions like narcolepsy or idiopathic hypersomnia. These are conditions where there are changes in your brain and it affects your sleep cycle. The part of the area of the brain called as hypothalamus, which plays a very important role in our sleep cycle, is affected. In narcolepsy, there is a deficiency of a hormone called as hypocretin, that causes narcolepsy. We don't know what causes idiopathic hypersomnia, but also in those patients, in spite of sleeping a lot, they still feel very sleepy. Depression, as you discussed, is a very common cause of excessive sleepiness. But population-wise, I would say depression and sleep apnea would be the two most common conditions.
You talk about sleep apnea, and a lot of times when I have patients that come to my office and they'll say, I'm dreaming too much. I'm dreaming excessively, and I'm always tired all the time. I can't get a good night's sleep. Doctor, can you give me a medication for it? And the first thing I ask them is, whoa, you're dreaming very vividly and you want a medication. The first thing I think of is, are they overweight and are they snoring? So Dr. Kaza, you're the expert here. Tell us a little bit about what is sleep apnea, and maybe if you can elaborate on some of those treatments, including that's a CPAP device, and then where do you come into the picture when a CPAP doesn't work?
Okay, so sleep apnea is when your airway closes down as you sleep. What happens when we fall asleep is our muscles relax, and there's no point where we relax more than in deep dreaming sleep. In that REM sleep, you lose all your muscle tone, your tongue falls back, your throat relaxes, and suddenly the airway that you keep open all day long can collapse. Normally, when you're awake, you're taking in breaths, like maintaining your oxygen at all times. When you're asleep, it has to drop and your carbon dioxide level has to go up for your brain to sense that something's not right. And when that happens, your body will make a big effort to breathe. And sometimes it's working against blockage in the throat. So the best way to treat it in adults is going to be a CPAP machine. Dr. Chakurkar manages those, but the idea is that it's offering you continuous airflow and sort of putting pressure to keep all those passages open. In children, and I see this a lot in children actually, the treatment's going to be different. We're going to be taking out their tonsils and their adenoids, which are the common reason to sort of block that airway. Children don't get CPAP machines. But for adults, the primary treatment's going to be non-invasive positive pressure therapy. And when that fails, we start to look, patients often come to see me for structural problems. Go ahead.
So you're talking about children. What is the age group that you're thinking about, or that you see walk into your office? And are the parents coming to you saying, my child is snoring, take their tonsils out? Tell me how that happens, because we're often thinking of adults that are tired, that are sleep deprived, but we don't think of children and sleep in the same way. So how does that, to take us through that journey, what is that pathway from a child not sleeping ending up in a specialist's office like your own?
Well, in the early years, as you alluded to, so much changes in sleep patterns. So the very newborns, the infants, they have fragmented sleep. They don't really have organized sleep till they're several months old. So parents are often dealing with sleep training and behavior. The respiratory stuff, it's very common, not to go too far off track, but there's central apnea and obstructive apnea. Central apnea is when your breathing stops because your brain isn't registering that it's time to take a breath. Okay, obstructive apnea is when your brain registers and you're making an effort, but your throat is blocking that entry of air. So infants, very young infants, it's very common to have central apneas where you'll pause and stop breathing for 20 seconds at a time when you're 2 to 4 months old, which is really scary for parents, but that's in the normal range. As kids get a little bit older, usually, you know, in the toddler years, you're getting a lot of big adenoids and tonsils, congestions and colds. That's when you see the kids snoring, mouth breathing, sometimes pausing, waking up at night. And it can vary a lot, you know, and it's tough because adults get sleep studies, which actually tell you how often and how severe your obstruction is. Children, more commonly, we go by what parents observe, right? And so the parents are observing things like behavioral problems during the day. They'll may witness the apnea or pauses in the breathing at night following the snoring. And they may find, you know, bedwetting, night terrors, some other behaviors that can happen during sleepwalking, all of these things, you know, they don't happen directly because of sleep apnea, but sleep apnea certainly makes them worse. So those are the parents I'm seeing, the parents that are not sleeping because they're afraid their child has completely stopped breathing at night, or they're noticing some behavior things that, you know, they're challenged with, like ADHD, concentration problems at school, and all of this can be a reflection of poor quality sleep at night.
And it's an important thing to think about is when I think of ADHD, a lot of times parents will say, you know, my child's not focused, they're not concentrating, and they're not actually thinking about sleep. They're not thinking about, are you creating an environment where a child can have restful sleep? And you bring up something else, which is the mouth breathers. I often tell patients who have migraines, are you clenching your teeth at night? And the underrepresented person who's not on the panel today is the dentist. We really need to pay attention to the dentist, and the dentist can tell you a lot about your habits by just looking into your mouth. Are you a mouth breather? You know, is there malocclusion? Are the teeth changing shape? Because they also examine adenoids, so make sure that you're also visiting your dentist and you're having those conversations with the dentist, because they'll tell you what's going on, and sometimes even before a pediatrician will, or even before you get to a specialist like Dr. Kaza or Dr. Chakurkar. Sometimes we get these questions about folks that have a shift kind of work, and they say, well, what does it mean for me if I'm awake at night, because I do shift work, and I'm asleep in the day? And I'm brought back to my days of residency when we had to do it. I'm sure you had to do this too, the graveyard shift, where you had to be up all night and you had to be asleep in the day. And one of the clever tricks that we pulled in my residency was that we turned on a light therapy lamp, which is what can be used in for depression or seasonal affective disorder. And the light therapy lamp, we turned it on at nighttime so that we could flip our rhythms. And in the daytime, we put these dark sunglasses on. And I got to tell you, within 2 to 3 days, we completely flipped our circadian rhythm, and we were done with our 6-week rotations. We flipped it right back. And that's the power of light, of photostimulation. Dr. Chakurkar, what are your thoughts on photostimulation affecting our circadian rhythm, but just affecting our ability to drift off into good, meaningful sleep, a REM-rich sleep?
Photostimulation is very important. We see it every single day, and I'm sure even you must have observed it. Sometimes you are traveling and you travel to the West Coast, where the days start later and end later as far as we are concerned. And when we go there, there is a bright sunlight in the evening. We get exposed to that sunlight, and that shifts our clock, and then we sleep later and wake up later. Well, you travel to Europe, you know, where it is opposite happens, where again you have to increase your exposure to the morning light so that you can wake up earlier, and use dark glasses so that you can go to sleep earlier. We see circadian rhythm changes because of the photo light effect in teenagers. You know, all teenagers, they love playing their video games, they love chatting with their friends at night, they do everything at night, and they are constantly getting exposed to the blue light from the television screen, the computer screen, the phones. And that again is a part of the problem why their sleep cycle tends to shift to a later period of the time. As you get older, in older patients, their retina, there are changes in their retina, probably related to their medical problems. The cells are not registering as much light. You develop cataract, and that again is partly responsible for their sleep moving earlier. So light related circadian changes are seen pretty much everywhere. it is more common in this century. I mean, about 100 years ago, there was no light. So there were dim, lights with maybe a candle or something. So people were able to sleep better. We are now in an era where there is a 24/7 electricity and 24/7 lights. That has definitely affected our sleep, and not in a good way.
In a really bad way. We've evolved, and in a timeline of history that we try to cheat our evolution, and we try to pretend that I can do things artificially, and artificial is fun, but you're right. The fact that we can imitate sunlight with a lamp, the fact that we're supposed to be winding down around sunset naturally, and we wake up around sunrise, that in the wintertime we are going to be more tired, we are going to be slow, we're just going to be on low power mode, and yet in the summertime it's the opposite effect. So sleep changes with the season. You won't get 7 hours of sleep every single day throughout the year. That circadian shift occurs. Dr. Kaz, have you noticed anything with the young patients when you perform procedures and they're sleeping better, hopefully? What do parents come back and share with you post-operatively, and just maybe 3 or 4 months down the road?
Absolutely. The children, interestingly, are much better about it than the adults.
They're not watching cartoons. They're not watching their Disney Pixar.
Right. The parents, we do talk about sleep hygiene. That's sort of the general term for some of the things you're talking about. How do we take care of ourselves to get a good night's sleep? I think parents do make a good effort for their children, and they're conscious of their children's habits when it comes to bedtime and screens and all of that. I think the adults are the ones that, struggle with a little bit more. We do see the same issue you described in teenagers quite a bit. Because they have that so many demands on their time, and the school schedules aren't really matching with what their natural circadian rhythms are. But yeah, I'd say the kids are fine. It's the adults that have the light problem.
I'll often tell adults when they come in and they say, Doc, I can't sleep. Often it's stress related, and it's not always possible to remove whatever the precipitant of that stressor might be. But there are things that you can do that can be helpful for you to get at least better restful sleep. Dr. Kaza, when you give that advice about sleep hygiene, whether it's an adult or whether it's an adolescent or a child, what are some of the key things that you like to share with your patients regarding sleep hygiene, but also just in general, how to rebuild sleep architecture?
I don't actually counsel a lot on sleep hygiene. I do talk about setting regular bedtimes, avoiding screen time before bed. Most of my patients is primarily obstructive problems. So that sometimes not eating late at night before you go to bed so you don't have reflux, sleeping up on a couple of pillows if that's more comfortable for you. Positioning side, the type of bed you have, the temperature of the room and the humidity of the room, breathing, your nasal breathing. So you want your humidity to be around 60%, 40 to 60% humidity for the air. Low temperature at night is better for sleeping, 65 to 70 degrees, no higher than 70 degrees in the bedroom. So those kinds of things, will improve your nasal airflow, for example. I would mention that, I talked a lot about the throat when we talk about obstructive sleep apnea. I do think that's where most of the actual oxygen blockage happens. But people come to me a lot about stuffy nose, and that being a reason that they don't sleep. That usually doesn't cause the apnea or the drop in airflow, but it does cause poor quality sleep. So some of these other things that improve, your air quality in your home and your bedroom also will, improve your nasal airflow and make you more comfortable and sleep better through the night.
What a great point. As we're in our spring season, there's so many allergies out there, pollen, and lots of folks will come in and say, gosh, I'm on Benadryl and I've got to take all these antihistamines, and they're very groggy, but because they're really trying to get really good sleep hygiene. And part of the things that I also share with patients is wash your pillow covers, wash your sheets, take a cool shower at night. Some patients like to drink tea, and I think that's a great idea if you want to drink an herbal tea, but just be mindful that if you're approaching a menopausal state and you're already feeling hot and flushed, as some women may experience that and they can be perimenopausal, I tell them you might want to drink that cup of tea maybe an hour before bedtime, even if it's chamomile, because it's going to increase your core body temperature, and you really want to bring that core body temperature down. Make sure that you're wearing the right kinds of clothing, that it's not these nylon or artificial fabrics, cotton, fabrics that breathe. I call it grandma school of medicine. Some of this stuff does not require you to go to medical school. It's just basic common sense. Dr. Chakurkar, I know that you had a couple of thoughts on getting restful sleep. So for those individuals that really struggle with sleep, and they don't know how to get restful sleep, whether it's age related, and we try to avoid prescribing drugs if at all possible, because again, you could build that sleep architecture. It takes infants months to do it. Adults can do it too. It can take a little bit of time. But what are some of the things that you might share with your patients as we're wrapping up to help them so that they can rebuild their sleep architecture if they have lost it? And people can lose, they can get out of shape with their bodies. You can get out of shape with your sleep architecture too.
One of the most important things that I share with them is a role of exercise in sleep. Okay. Exercise at any time of the day is helpful. It's one of the natural ways of getting into deep sleep, which is a very restorative type of sleep. Okay. So regular exercise is a key. For the other important facet that I share is a stress management. Okay, modern life is full of stress. There is stress in our personal life. There is a work-related stress. There are a lot of stresses that you have to deal with on a daily basis, and it does affect our sleep at night. Okay, so managing your stress is very important. Exercise would be a good way to manage. Meditation would be a good way to manage your stress. So learning to meditate about 15 minutes a day, 15 minutes per day is very useful in getting into a good quality sleep. Other thing I tell them is to have, is that a brain is a dimmer switch. It's not an on-off switch. You cannot go from a full on to full off in 30 seconds. It doesn't happen. You have to slowly decrease your brain's activity to a point where it gets ready to go to sleep. Okay. In order to get your brain ready to go to sleep, you have to start about 30 to 60 minutes before your bedtime.
Right.
Don't balance your checkbooks just before you go to bed. It's not going to, it's not going to make you.
Yes, no serious conversations, no serious pillow talk in the bedroom. And I agree with you. Even the stress management, not watching news at all. What is the role of obesity? Tell me what the role of obesity is as people are trying to find a way to be healthy, because we're also talking about sleep apnea as well. How does that affect sleep?
Obesity increases your risk of sleep apnea. So that is a more direct role that is play. Then other thing is that obesity is associated, it's considered an inflammatory state. So there is more inflammatory chemicals in your body, which also affect your sleep. Okay. Obesity also increases the risk of your other medical problems such as hypertension, heart related issues, which again indirectly affect your sleep. So losing weight will help you get into a healthier sleep.
Right.
Exercise that you need to do to kind of maintain your weight or lose your weight again will help you with a healthy sleep.
One of the things I saw an uptick in 2020 was alcohol consumption really went up. And then it was interesting. I think everyone just gained a lot of weight. And one of the things that my patients would come to me with is, doctor, I'm not going to reduce alcohol intake because you're telling me to. I'm going to reduce it because I've gained too much weight. And I said, wow, what a motivator to get folks to reduce their alcohol intake and, drink more water. But alcohol can also change sleep architecture because it's tricking the brain, it's suppressing the brain, and anything that feels unnatural to the brain, whether it's a sedative drug, whether it's alcohol, brain doesn't like it. Brain doesn't like to be bossed around and pushed around by external forces. And so it's going to react by creating changes in sleep architecture. But even if by drinking one glass of wine a night, and if you're not sleeping well, you might want to think about removing the things that are artificially changing your brain's biochemistry, because that will cause your brain to basically, Empire Strikes Back. It's going to make you not sleep well. And it can take a few months for your brain to recover from even mild alcohol use if your sleep's been affected.
You're absolutely right. Even one uh, drink of alcohol in a person who is not used to it is going to affect sleep. It's going to cause suppression of the dream sleep, which is a very important type of sleep for our brain's function. And then it causes REM rebound later at night. And a person who is a chronic alcoholic and he's recovering from alcoholism, it takes months for the sleep pattern to go back to the pre-alcoholic sleep pattern. And caffeine again, taking caffeine in the daytime whole helps you focus, help you stay awake, but it stays in your system for a long time.
It's like a bad credit card. Caffeine borrows from the future what you need to be using today. It's a great con artist.
Yeah, so you need to stop drinking coffee at least 8 hours before sleep. And if you have a condition like insomnia, you need to be extra careful with your caffeine intake. Same thing with cigarettes. Nicotine also helps you stay awake. So you smoke a lot in the evening or at nighttime, it's going to affect your sleep. It also affects your dream. You tend to get, if you use nicotine late at night, or you wake up in the middle of the night and smoke, you're going to get nightmares from it.
So Dr. Kaza, this kind of brings up what you were mentioning, is that for the kids, they follow instructions, but a lot of complications, because grown folks they want to keep doing the things they do. They want to kind of indulge in the habits they have. And so just kind of in closing, sleep is not an elusive a thing. You can get your sleep back if you're struggling with sleep disruption. It does require a kind of discipline. You want to be a child in that sense. Just listen to the doctor that's trying to be your parent, that's trying to help you out, because we really do want you to sleep better. Start off in small steps. Certain things that you want to do that you don't stress yourself out at. Turn your clock around. I always tell people when they wake up at night and they're looking at the time, stop it. Turn the clock around. Reduce that temperature in the room. Just like Dr. Kaza said, get that humidity to a place where your mouth and your nose, that they're happy. Make sure you go to the dentist. Make sure that you're consuming the right beverages. You're eating the kinds of foods that are going to promote sleep. Pay attention to your environment. You are one with nature. So if you are really paying attention to your environment, then recognize sometimes you're going to sleep a little more, sometimes you're going to sleep a little less, and then embrace aging. Aging is a part of just being human. And as we age, when you don't sleep at night, just like with skin, we can put lots of creams on it, but at the end of the day, we're still going to age. That, do something productive in that time. Reduce photostimulation. Don't watch the news. No serious conversations at bedtime. That is the worst time to have a conversation, because you're just going to affect your ability to fall asleep, and you're just going to have bad dreams. So think about happy thoughts when you go to bed. Read a nice book. Don't put it on your iPad and Kindle. I know lots of you like that, but something that's tactile. Have rituals. Have routines. There's nothing your brain, your body loves more than routines. Create that scaffolding. Create that structure. That's actually where creativity comes from. And get your teenagers to go to bed earlier and to wake up earlier. And if they don't listen to you, don't worry, because when they become adults, they'll turn into you anyway. So we're going to open it up. I don't think we have any more questions coming in from the floor. I'll wait for the moderator for us to conclude our discussion. Dr. Chakurkar and Dr. Kaza, I so appreciate you coming here today. I think we're ready to go ahead and wrap up. I thought this was a great conversation. We'll leave it for a moderator. I just wanted to thank everyone for joining us today. We hope you got a little bit of a benefit from our conversation. Consider this an amuse-bouche, or a little bit of appetizer. We have a lot more information online. If you visit our website, we've got great kinds of ways for us to get guided imagery. We offer lots of sleep classes. We offer lots of advice. Every doctor is aware of it. We know all of our patients come to us with sleep questions, and we can come back at you with all different kinds of perspectives. The idea is for you not just to enjoy your life, but to thrive. So thank you for joining us today.
Thank you.
Thank you. Bye.